other ones that were mentioned on that in the bill hearing, like about making an emergency bill and all, were they in there too? So we have to vote on them then?
Yeah, we discussed them yesterday, but yesterday is a calendar.
Right. Okay.
Senator, what's the bill? The first one, 67. Say again.
Email came from Alexis Foxworth.
From a who?
Alexis Foxworth.
Yeah.
Is there a hard copy for the file?
It's no, there is a hard copy. I can go
We
ahead.
will need a hard copy
Okay,
for the file.
okay.
Yeah, I got it.
Needed money.
Teachers have jobs. The check's in the mail.
Yeah.
Let's go to 125, and the people who are late can just add their vote, because I don't think there's going to be much opposition. So whoever can present 125?
Extending the board of the chiropractor.
Right, sunset review. Is that you, Alexis?
Yep, that's me.
Please begin.
So the bill is pretty straightforward. SB 125, State Board of Chiropractic Examiners, sunset extension. What this bill would do, it would extend the State Board of Chiropractic Examiners by 10 years from the current date of July 1st, 2022 to July 1st, 2032. This will be subject to evaluation by DLS under the Maryland Program Evaluation Act. There was no opposition and no amendments presented.
Okay, it's been moved. Is there a second? It's been seconded. Again, it's the sunset review. Is there any discussion? Any discussion on the sunset review? Seeing none, will anybody be voting against it? Seeing no hands, it's unanimous, and I think it's all present, which is great. Okay, that moves, 125 is passed, and we'll go to the floor. Let's go to the other sunset review, which is real simple, 247.
SB 247 is very similar. It's another sunset extension. This time it's for the State Board of Podiatric Medical Examiners, and it's to extend the sunset date of the board responsible for licensing and regulating podiatrists by 10 years to July 1st, 2032, from the current expiration date of July 1st, 2022. That is me as well. SB 141, State Board of Public Accountancy, Education Requirements and Obsolete References. The bill is also another straightforward one. It updates the names of 2 accrediting institutions that have since updated their names as it pertains to certification for public accountants via the Maryland Public Accountancy Act.
Anybody want to discuss or have questions? Seeing none, we'll go to appear to vote. Will anybody be objecting or voting no? Seeing no hands, we'll mark that as unanimous. 141 will move on to the floor. Okay. Let's go to 342.
Senate Bill 342 is a departmental bill which alters the process for the Maryland Department, the military department, to dispose of armories that are superfluous, thank you, to the department's needs to conform to current law regarding the disposal of excess and surplus state real property. There is an amendment in your packet on page 3. This is a technical and corrective amendment which just clarifies that the Department of Planning is the agency responsible for determining whether another state agency is interested in the property under current state law.
Okay, before we have discussion, let's get it on the floor, so we have something to discuss. It's been moved and seconded. We'll take discussion and then we'll get the amendment, unless you object. Can you move the amendment? Any objection to adopting the amendment? Okay, what's on the floor is a bill as amended. It's open for discussion or questions, Senator White.
Thank you. Did you distribute the packet? So this is a technical thing. I don't have a packet. I came right from the floor. Was a packet distributed to our office? Or?
The packets were emailed to your office
couple days
before
ago.
yesterday's bill hearing.
Great. Okay. All right. I will.
Yeah, and we can have a discussion afterwards about how or if we want to be delivering physical packets in addition, or whether.
I might have it. I'll look.
Okay.
Yeah, and Senator, this was, even the agency said it was drafted, and it should have had Department of Budget Management in the language.
Thank you, sir. I got it.
Okay. Discussion on the bill itself, as amended. Discussion. Seeing none, we'll go to appear to vote. Anybody have an objection to how they deal with the excess property? Seeing none, I'll assume it's unanimous without objection, and Senate Bill 342 will go to the floor. Okay, moving right along. Let's go to 350.
This is a departmental bill from the Maryland Department of Natural Resources. It repeals provisions governing the establishment of aquaculture enterprise zones in the Chesapeake Bay. The bill also authorizes the department to issue an enterprise lease to a person for the use in waters of the state to assess the feasibility of cultivating aquatic plants for commercial purposes. There is an amendment in your packet on page 4 being offered by Senator Pinsky. This was in response to Chesapeake Bay Foundation's testimony on the bill, which specifies that only native and naturalized species of aquatic plants may be grown in enterprise leases. DNR has indicated that they consider this a friendly amendment.
Okay, it's been moved with the amendment favorably by the Vice Chair. Is there a second? The second, Senator Patterson. Discussion of the bill? Discussion of the bill. Seeing none. Anybody voting against or favorable? Raise your hand. Seeing none. We will record Senate Bill 350 is unanimous and send it to the floor in that fashion with the amendment. Let's go to 262. We'll save the minutes for last.
Senate Bill 262, Department of Information Technology, study of a common information technology platform for Health Occupations Board. This bill would require Department of IT to review the current platforms that each Health Occupations Board has and will determine recommendations on how feasible it will be economically and otherwise to standardize the platform. A portion of the recommendations will include standardizing website appearance, creating the ability to receive automated notices and newsletters, and to create a common platform for licensing.
It's been moved. Is there a second? Second. Discussion. This is for the Health Ocs to have a common platform, renewing license and things like that. There was no opposition. There were letters of information from MDH, but no opposition. I haven't actually read it carefully. Most folks have been fine with it. Further discussion, seeing none. If you will be voting in opposition to a favorable, or you don't want the bill, please signify by showing your hand. Seeing no hands, we will record this as unanimous and send it to the floor. Okay, we're to the last bill. SB 67, can you refresh our memory and present it again?
Sure. So coming around now, looks like there will be those amendments proposed by Senator Lamb and an unofficial reprint of the bill. But to refresh, this bill, SB 67, is a departmental request by MEMS, Maryland Institute for Emergency Medical Services. It permits paramedics to administer vaccinations listed on CDC's recommended vaccination schedule and tuberculin skin testing. The bill authorizes the vaccination services to be provided with conditions so long as it's authorized by MEMS. The services are given under the direction of EMS. The services are provided in connection with the local coordinated health effort. And finally, that there is a written agreement between the emergency medical services and local health departments. Thank you. And local health departments. There was no opposition presented at hearing. However, council later received written testimony from the Love Maryland Pact, which talked about some issues that they had with training for the vaccinations and liability in terms of any type of fallout from the vaccinations. So let's go through.
I'm sorry, what were you going to suggest?
I was going to say we could probably look at the MEMS amendment first.
Okay, and then we can have Senator Lamb explain his amendment. So please go through the first amendment.
So I mentioned these yesterday, but there were 4 amendments by MEMS. One was technical. One was to change the position of EMS operational program to EMS operational program medical director to provide clarification to the public. One is to add vaccinations that are authorized for emergency use by the FDA, and the final one is to make the bill an emergency measure.
Most significant is amendment number 2 in your packet, where it inserts authorized for medical use by the FDA under 564, the Federal Drug and Cosmetic. That's probably the most significant of those amendments. Before we take up the bill, well, let's put it on the floor. Is there a motion? It's been moved. Is there a second? Just get it in front of us. Okay, the bill is before us. Senator Lamb, why don't you walk through your amendment before we move any of the amendments?
Could we just clarify?
Sure.
The reprint, please, is with the MIMS amendment, not with the Lamb amendment, correct?
I'm sorry. So the reprint is with Senator Lamb's amendment. The reprint that you all just received.
So the chairman just referenced a MIMS amendment.
That was in the original packet.
Okay.
That's correct.
Which is on which page in the original packet, please?
Page 1.
Okay.
Page 2.
Page 2.
Page 2. Okay.
Look, do me a favor. Hold on the reprint for now. You were sent the amendment, right, from Senator Lamb?
Yeah, from Alexis, but yeah.
Right. Let's just focus on Senator Lamb's amendment for now.
And the motion on the floor is for the MIMS.
Right now, it's just for the bill. We haven't added any amendments yet. I want us to be clear on the 2 amendments, what they do, whether interchangeable, or we want to take one a priority over another.
Thank you for clarifying.
Yeah. Okay, Senator Lamb?
Sure. So thank you, Mr. Chairman. The question, I presented this question, I think, during the hearing, which was that the Secretary's order from January 1st, and actually he revised it today, but that doesn't change this part of the order, allows paramedics to administer the COVID vaccine. It also has a very broad catch-all that says anyone that is trained and supervised would be able to administer the COVID vaccine. I think that all makes sense, and I don't have a problem with that. I think what my question was during the hearing was, why is this bill needed then? Because they already have the authority currently that's been given to them by the Secretary's order to be able to actually administer these vaccines. And obviously, we want to administer these as quickly as possible, and as many people that are qualified and trained to do this should be doing this. So, I think when you look at the bill itself, it actually it goes beyond just the COVID vaccine. It actually casts a broader net by allowing any vaccine that's been essentially recommended by CDC. So that's where it says, I think, it cites the fact that the paramedic may administer a vaccine included on the recommended adult immunization schedule from the federal CDC, as well as TB testing. So it just, I guess opens the door very wide for potentially anything that's recommended by the CDC for paramedics later on in the future at some point to be able to administer. We don't know what the CDC is going to eventually add to this list of recommended vaccines. Maybe, I guess my concern is that they could add some vaccines that are very complicated to administer in the future or require a lot of follow-up. We just don't know what they'll do in the future. We don't know what kind of vaccines or what kind of technology there will be. And so my recommendation is to just limit it to the COVID vaccine, which we know about right now. We want to get as many people administered as possible. And the amendment then would still allow that to happen. It's just that it's specific to the COVID vaccine itself, instead of opening it up to any recommended vaccine by the adult immunization schedule. So I was just recommending putting some guardrails on this, and then also making it time limited because hopefully this pandemic will end, and to give them this authority through, I think, 2022. I think it's through May of 2022.
I'm going to ask a question, then I'm going to call to Senator Riley. So the Hospital Association makes the point that if the emergency proclamation by the governor ends, COVID vaccinations might still be needed after that. Mm-hmm. So I haven't read this carefully. Would this is based on a date rather than the emergency proclamation, your amendment?
This is based on a date, yes. So the amendment dates it to, I think it's May 1st or April 30th, 22.
Okay. Senator Riley.
Doctor, I'm an insurance salesman. I have just a passing understanding of this disease that we're facing. Am I correct that this is COVID-19, that there were 18 other COVID diseases in the past?
There were not 18 other COVID diseases. COVID-19, because of what the term COVID-19 is only referring to this specific one.
That's right. That's what I'm saying.
There may be other coronaviruses. Coronavirus is a broad class of a type of virus.
Yeah.
We say coronavirus now to be synonymous with COVID-19, but it's not technically.
Yeah, my question is, aren't we going to have a COVID 20 and 21 and 22 and 23?
So COVID-19, the 19 comes from the year that it was founded. So hopefully we don't
right,
have
I got
21
that.
to 22.
But my point is, we are susceptible to pandemics in the future, or terrible, maybe not pandemic, but a disease like this. So my point is, the next COVID infestation to our nation might be a COVID-22 in the year 2022, or COVID-23 or 24. So having this in place gives us belts and suspenders for future wide-ranging problems.
So it may not, because future pandemics wouldn't be called COVID-19. So this one is, and
oh, it says COVID-19.
It says COVID-19, yeah. So like previous pandemics like SARS or MERS, so it would have to be, previous pandemics don't always have the same name, right? And so, with SARS, it was something different, right? And we didn't have a vaccine for SARS. So this would be just for COVID, which is what they're hoping to do, and obviously that's good, to support them with that.
Thank you, Mr. Chair.
Senator Gallion.
Just to be clear, we're under discussion on just this amendment right now, correct? Yeah. Okay, thank you. So I appreciate Senator Lamb's cautiousness, as it relates to issues like this. I really do. But I've had the opportunity. I've been in the volunteer fire service for over 25 years. I was a chief for 6 years. So, I was in charge of making sure the ambulances hit the road every day, and I have a pretty good understanding of the emergency medical system when it comes to first responders. And I think it's important to note that since 2000, paramedics have already been able to give influenza and hepatitis B vaccines and also TB skin testing. This bill, as mentioned, without the amendment, you're going off. You got to deal with the CDC recommended schedule or authorized by the FDA, and MIMS. You hear that acronym for the folks watching. I know this is being broadcast. Stands for Maryland Institute for Emergency Medical Services System. Anything that's done will be through under the direction of MIMS and the medical director, who is a doctor. So it's going to come. I would argue that there are sufficient guardrails in place for this. And I just wanted to kind of put apples to apples what paramedics already can do compared to what they could do with this bill, which is potentially down the road give other intramuscular shots like that. If somebody's in cardiac arrest, a paramedic can give epinephrine. Now this is IV, this is not intramuscular. Adenosine for high heart rate, cardiozen for irregular heartbeat. So we already trust these paramedics to give these life-saving emergency drugs. Why wouldn't we trust them to give an intramuscular vaccine? To me, I think the amendments are well-intentioned, but they completely gut this bill. So I would encourage the folks on this committee to vote no on these amendments. Thank you.
I'm going to go back to Senator Lamb. Look, obviously we have shots on COVID, the immediate emergency in front of us. I think what I'm hearing from Dr. Lamb is this is a bit of an overreach, and I think that begs the question of what is the concern of what shots could now be done under this proposed bill that we should be concerned about. And Senator Gallion has said that they obviously already have authority to do certain other shots. Mm-hmm. So back to you, Senator Lamb.
Yeah, and I don't have any concern with them doing the shots that they're currently doing. So they currently have the authority to do TB testing, to do some of these other tests that were, or vaccines that were cited in here. And this wouldn't take away any of their authority to do that. And that's okay because, like you mentioned, paramedics are trained. They do have training to be able to give intramuscular injections, and that's fine. I think my concern is about things that we don't know that's coming down the line. Like we do know about some of these cardiac drugs that were cited. We do know about how a TB test works. We do know about, how a flu vaccine works. Those are all known things. And what this bill as written would do was would open it up to them being able to administer anything that the CDC says is on this list. And the CDC at any point in the future can add to this list, and it would automatically be something that paramedics could give. It would have taken it out of our hands and put it into the CDC's hands. And so, I don't have any problem with what they can administer now, and I think we should add COVID vaccine to that, and that's fine. I just don't know what some point in the future CDC could add to this list that would allow them to be able to administer that, right? And we just don't know. That it could be much more complicated than the COVID vaccine, much more complicated than the influenza vaccine. We don't know what might come down the line.
I'm going to go to Senator Carrozza, then Senator Gallion. I'll come back to you.
Thank you, Mr. Chair, and I appreciate the discussion on the amendment. I just want to point out that this is an important bill for rural areas, and that MACO supported the bill as is and does not support this amendment. And that's, I think, important for the committee members to know before they vote. I also think this is important for as far as the role that paramedics play in our communities, especially in areas where we have shortages of doctors. So I'm going to be supporting the bill as introduced and not supporting the amendment.
Let me, before I go to the next speakers, and I have Gallion, Ellis, and Washington. I'm sorry, and the Vice Chairman. Senator Carrozza, did those organizations say they oppose the amendment, or, I mean, I understand they supported the bill when it was introduced. We obviously haven't heard what Senator Lamb's saying. Do we know for a fact that they oppose the amendment?
I have correspondence from MACO that they oppose the amendment. They support the bill as is.
Then we'll go to Senator Gallion, Ellis, Washington, and Kagan.
Mr. Chair, I believe Senator Ellis was in line before me.
Okay. Thank you, Mr. Chairman. I'm leaning towards supporting Senator Lamb's amendment for one reason. This bill affects emergency medical technicians, EMTs, paramedics, right? Their main job is out there to respond to emergencies. Someone's having a heart attack, someone having a car accident. I believe if we have them authorized to do too much, they're pulled off from being ready to be there to serve us, and they're doing regular medical care. You know, I know in the last few years, the rules and the tests for paramedics, EMTs, have been really made very stringent, and we have a shortage of these folks. You know, a lot of them say, you know, I'm not going to do that recertification. It's too complicated. It's too hard. And so for a county like mine, Charles County, which is still relying on a lot of volunteers, and, you know, this is a problem, the few professionals we have who are full-time, to have them detailed, say, to the Department of Health for whatever good cause it might be, vaccinations, but it takes them away from being ready to jump in that vehicle and rush to the heart attack, rush to the accident scene. So I have an issue with just having them being able to do all these things and to be misused by any health department, whatever, and not being ready to do their main job, which is there for those emergencies, which do come up from time to time.
We'll go to Senator Gallion, then Washington, and then Kagan.
Thank you, Mr. Chair. And on those most recent by my colleague, these folks, as I mentioned, are already doing some of these vaccinations, and having more folks out in the field that can administer stuff, I think, is a good thing for the population because it's more spread out, makes it more available for our citizens. So that's kind of the other side of that coin. A couple things I just wanted to highlight.
Senator, just for clarification,
Sure.
I hate to interrupt. This bill or the proposed amendment doesn't limit them from doing what they're doing now.
If the bill doesn't pass at all, they'd have to stop doing it when there's no longer a state of emergency, is my understanding. They can still do the ones they've been doing since 2000. But,
Right.
you know, with COVID, when
Right.
the state of emergency ends, they couldn't do that without this legislation.
They couldn't do COVID without the legislation if the
Correct.
state of emergency ends.
Correct.
But the other things they've done, TB tests, influenza, they've been able to do it either with or without this bill. They'll continue to be able to do it. Is that correct?
Yes.
Okay.
But
Sorry. Please.
So back to the subject of the guardrails, and I think this is a really important part. I spoke to MIMS about this bill, and these initiatives come under a county health department or hospital system initiative. They're not just willy-nilly going to be doing this on their own. They're going to be under these strict guardrails. And also, I just wanted to reiterate, this is authorized by MIMS, that medical system I spoke about, and it's under the direction of an EMS medical director. It's not like any paramedic's going to say, well, I feel like giving this now. There's a lot of steps to go through, and there are guardrails that are, in my estimation, more than sufficient to do this. And, you know, that's my feelings on that. Thank you.
Thank you, Chairman. I think Senator Ellis has sort of highlighted the direction that I was going and being cautious that I know we want to get as many people as possible, that in this state of emergency and concern that we don't want to overreach. I'm happy to hear that the EMTs and EMS workers are going to continue to do the work that they're doing. It is emergency, and so it should not, in my opinion, substitute providing traditional or other ways of providing for healthcare services to rural areas. So I think that putting a very specific focus on COVID-19 for now, that we could take up the broader issue and make a policy decision, but I feel that to make it too broad is being reactive, and to set some cautious guidelines here for now, so as amended. So I support the bill broadly, but I also support putting these guidelines and making it very specific to COVID-19 right now. And yeah, that's my position.
Chairman, first, I just want to say that I think.
Senator Washington, could you turn off?
Yep.
Thank you.
Thank you. First, I just want to say that I think this committee is super lucky to have Senator Lamb on committee to bring his healthcare expertise and his very deep experience on this issue in particular. And so I'm taking his concerns very seriously. I am not going to try to sound partisan, but I hope people don't hear it this way, but I fear that there's a little bit of PTSD that some of us are experiencing after the CDC's super partisan guidelines that have not led our country well through COVID because of the former president. Fundamentally, I trust the CDC. I trust MIMS. I trust our government. I trust the people that any governor will appoint to take care of the public health. And I worry that we're all so paranoid and worried about some of the decisions that have been made lately that we're putting up guardrails that are too high. My concern here is that this emergency language expires too soon. April 30th of 22, we will have been out of session, assuming that God knows that we're all here next year, safe and healthy. It'll be 10 minutes after we adjourn, which requires then emergency action next year. I think we should be thinking longer term and not going from emergency to emergency, and be thinking longer term from a policy perspective. So at the very least, if the sentiment is for the Lamb Amendment or a version of the Lamb Amendment, I would urge it to be broader and last longer, because I do think that something that gets us just through next April 30th is too soon. So I offer that for your consideration. So my instinct would be to trust MIMS. If there's a modified Lamb Amendment that offers more support and trust for our public health providers, that is my preference. Thank you, Mr. Chairman.
Thank you. Before I call on Senator Lamb, let me just share a couple of thoughts. The hearing we held on this was not focused on the policy of expanding authority for EMS workers. It was more about COVID and COVID response. Now, I don't know if Senator Lamb's concern of these are going to add additional authority or powers is founded or not. I don't know. And I understand EMS and MIMS would like to expand the authority to do certain things. Now, there are things they can do now. There are things they can continue to do. Clearly, we want to make sure they can give the COVID emergency kind of service over the next however long, year or two or three. Again, I don't know if CDC is going to run amok and give them authority that they shouldn't have. We just haven't had that policy discussion. So there are a couple ways to look at this. I mean, one way to look at this, and it's sort of the reverse version of what the Vice Chairman said, is to pass the bill with the amendment and sunset it to see whether there are additional powers that come down the road in a year, 2 or 3, and if they do, and they're way beyond their authority, it sunsets, it has to be renewed. So that's one way to deal with it. So I trust these people too. we're also setting policy for the state going forward. So I understand Senator Lamb's concern. So I'm trying to figure out a happy medium here, given that we haven't had a full discussion. Because, for example, you know, whether MedCai is important or not, they didn't testify. I mean, are they concerned about expanded authority for these people? I mean, the hospitals had some suggestions for amendments. When something is packaged with COVID, the thing that stands out is COVID and solving COVID. If it is changing certain policy, we should be very clear that it's changing policy. That's all. And again, Senator Gallion, I don't know if it's right or wrong, and I don't know what's coming down the pike and who's going to be leading CDC, and they're going to say, if CDC says do X, these people can do X. I don't know. I'm a little bit conflicted. Let me put it that way. I think I had Senator Lamb, then I'm going to go to Washington, Carosa, and Kagan.
Thank you, Mr. Chairman.
Oh, I'm sorry.
And Simon.
Then let's do Lamb, Simon Ayer, if you don't, because he hasn't spoken. Lamb, Simon Ayer, Washington, Carosa, Kagan.
Okay, thank you, Mr. Chairman. So I don't have a problem with CDC. I do trust their recommendations, and I think my point with bringing up CDC is that they're making their recommendations on not who is going to administer the vaccine. They're making their recommendations as to what should be on this list based on who they think should get the vaccine. They will defer to the states on who can actually administer the vaccine. So if we were to say that anything that's on this list that CDC has said should be on this list, that these folks can now administer, you know, we basically said we will cede all of our decision making to this list, whereas CDC is not deciding on what's on this list based on who can administer it. They're looking at it based on the science of who should actually get the vaccine. So we have a policy wrinkle here that I think if we cede that authority, we're opening the door much wider than we were anticipating with this bill. The bill already moves some of the guardrails wider because without the bill, right now EMS, just to be clear, cannot administer these three things, the TB test, the flu vaccine, hepatitis vaccine, to anyone outside of public safety. Right now the guardrails are around, they can only administer the vaccine to folks within the public safety environment, so basically their own colleagues. By passing this, we're already removing that guardrail and putting it much wider, that they can administer this vaccine to the general public. That's already much broader than it currently is. And so if we're going to expand that to allow them to do other things in the general public, then my suggestion is to see how they do with the COVID vaccine, right? Because we're already going to expand the guardrails wider. COVID vaccine right now, if this is not passed, they can still, if this didn't pass, they can still administer the flu vaccine, the TB test, and the hepatitis vaccine to individuals within public safety, basically their own population, the firehouses, EMTs, et cetera. By passing this, we're allowing them to actually administer things to the general public as well, just the COVID vaccine. And we can see how they do with that and then decide if we want to expand that later on even further. So that's my suggestion on that.
Super quick clarifying question, Senator Lamb. Thoughts on extending the sunset date?
Oh, I'm open to that. If you want to extend the sunset date or push it back further,
Yeah.
That's fine.
Okay. Thank you, Mr. Chairman.
Yeah, thank you. I've been listening to both sides because I'm not really an expert in this area. I would tend to go with the middle ground. I think the chairman has a good point there. The main concern is COVID. We want to get that. I don't know that it's going to be 1 year, 2 year, whatever, but I would take a sunset. We can reevaluate it. I don't think you're going to have the executive branch going willy-nilly trying to get different vaccinations out there. But also, the legislature is slow to pass laws, and it was meant to be that way. The executive office is meant to react to situations. We don't know what's coming down the future, so I believe they should have that. So I would suggest we do go with put a sunset on the existing bill that would allow us to come back and review it and see if there is a problem and go from there. So I would support that if once we get past this.
Right, but Senator, does that, I assume that also includes adopting the amendment, which deals with the FDA, or not? I mean, is the CDC referred to in the bill itself? I mean, does amendment number 2 in their proposed amendments, is that relevant, Senator Lamb?
Yes, so,
He's asking any amendments to this one.
right.
I mean, CDC
Right.
is included in their original bill.
Yes, CDC is, I believe, in the original bill. It's that they would be able to vaccinate anything on CDC's list, that list called the Adult Immunization Schedule. That list is controlled by CDC.
But that's in the bill. I guess my question is Amendment 2 at all relevant that they are proposing on page 2 of the packet?
And you're talking about MIM's Amendment 2, right?
Yes.
Yeah, because that's allowing, I think, things that are FDA authorized, so things that are under emergency use authorization.
And is that different from CDC?
Yes.
Okay.
Yeah.
Okay. So I think what I heard from Senator Simon-Ayer, and I'm going to, after I get through this list, I'm going to put up 2 or 3 options, and we're going to try to decide this. But you're suggesting the bill with the sunset. Okay. Senator Washington.
Thank you, Chairman. I like, so I would support the Lamb amendment with extending the date, because I definitely agree with
Senator Lamb,
Kagan.
could you turn off your mic?
Turn-
It cuts into the volume of the person speaking. I'm sorry, Mary.
Oh, okay, no problem. To the point of passing something and then, okay. Oh, okay. To the point of, it's very difficult to take away a right that you've given. So to give an authorization and then evaluate it for a couple of years and say, oh, it was too broad, it's very hard to bring it back. I think it's easier for us to extend and thank you so much for the clarity, because Senator Gallion, it looks like we are extending the ability, of EMS workers to do what they're currently doing outside of their current body. So we're already extending that. And then also we're addressing very specifically the need for COVID-19 and having them being a part of that. So, and I also want to make very clear that it's not at all about not trusting. I mean, we trust these people every day to, with our lives, and certainly trust the CDC. But I think to Senator Lamb's point, we trust the CDC. The CDC policy is about what the drug is and its efficacy. It's our job to make the decision about who has the ability to actually administer these things. And so I think being more cautious and slower on that angle is our responsibility. So I think the medium ground is extending it, having it go past May 22nd, maybe to the beginning of the next legislative session. And so I would speak to this the Lamb Amendment with the Kagan extension. Thank you.
I have Senator Carosa followed by Kagan, followed by Gallion. So far, I'm hearing 2 options. The Lamb Amendment with a likely extension of some period of time, we'll say a year, which is a narrower focus but allows COVID as well as what they're doing now. And I've heard from Senator Simon-Ayer the bill with the sunset. So, yes. So I just want to try to clarify and bring us down to clear voting and choices. Okay. I'm sorry, Senator.
I just want to be clear, does that mean the original amendments that we heard at the bill hearing for that option? Okay, thank you.
Yeah. With the MIMS amendments or not? Yeah. Okay. So just to be clear, Senator Simon-Ayer suggested the bill with the MIMS amendment with a sunset. That was another option. So we have two options so far in front of us. We haven't defined extension of Senator Lamb's yet. And again, you don't have to speak to those two. I just wanted to say where we are to date to start moving in a direction of building either a consensus or a vote. That's all. You can speak to, it's open discussion on the floor. Senator Carrozza, I'll add you to the list. Senator Freihester.
Thank you, Mr. Chair. I don't know how many members are receiving the constituent requests that are coming in for getting their populations vaccinated. I actually have been asked to be a moderator on Monday. Our 3 local health departments on the Lower Shore plus Tidal Health Hospital and Atlanta General Hospital together are having this town hall to put out information on vaccines. The reason that I'm sharing this with the group is that I just want to be clear and make sure that our committee members know that the local health departments are asking for this departmental legislation. So this is coming from our locals. We also know that the hospitals, the Maryland Hospital Association, opposes the Lamb amendment as well. So you have MACO and the Hospital Association saying not supporting the bill with the Lamb amendment. I believe that Senator Simonaire has offered, an option here. But I go back to, I think anything that's viewed right now as limiting the role of paramedics in helping to get the vaccine out, which is impacting our constituents, especially in rural areas, it should be all hands on deck. This is an emergency to get folks vaccinated. So, I just, I understand now why the department came in with the bill and that it's coming from the local health departments, and I think that's important information to share with my colleagues.
Yeah, Senator Cruz, I think we have to get clear. His amendment has no effect on the EMS and MIMS delivering COVID vaccine. It does not restrict that at all. His amendment is to say, beyond that, things that we don't know of now, we shouldn't give them unlimited authority to do something that is selected by CDC next year. So I think we've got to be careful in what we say. It does not limit their ability to do COVID vaccines. And also, I have to say, I have nothing in the file that says the Hospital Association opposes this amendment. So I appreciate you saying that, but this didn't come up at the hearing. That's all. We're going to go to Senator Kagan.
I was going to forego my turn, but I just want to respond super briefly to 2 things you just said. One is that anything coming up at the hearing related to this amendment could not have come up at the hearing because we didn't have the amendment back yet. So I just want to have that on the record. And then second, Mr. Chairman, just for what it's worth, I did get a text from the Hospital Association. So again, a lot of people are just seeing the Lamb amendment now and are trying to reach out. So just thought I'd add those 2 facts for what I know. Thank you.
Senator Gallion. Hester, and then I'll come to you. She hasn't spoken. Senator Freihester.
Yeah. Thank you, Mr. Chairman. I also just got a text, and so I think personally, I'd really like to be able to check this with both of my local county health departments. But I actually have a question on. I mean, the amendment's like 2 pages long, and I'm not sure how, like, the reporting and the written agreement. Like, there's a lot in the amendment that I don't think we've necessarily. I would want to understand better.
It's the same thing that's in the original.
It's the same thing that's in the original? So there's no extra. Okay.
Lamb amendment, the back pages are just a reprint. It's what you see on the front.
Thank you.
Senator Gallion.
Thank you, Mr. Chair. Since everybody's telling what text we're getting here, I got from MIMS. They are willing to go on the record opposing the Lamb amendment that came from Deputy Director Gaynor. Also, we talked about this as a policy discussion. I think the original bill with the original amendments is good policy because we can't predict what's going to happen in the future. And I don't like the thought of, well, we need to be under a state of emergency to do something in a situation like this. This would give them flexibility to do something in the future. Nobody thought 2 years ago we were going to be dealing with COVID. Well, maybe a few people did, but none that I know. So this gives us flexibility in the future. And then the other question, which was a great question brought by two of my colleagues here, was about overworking our EMS system. So I got another text from a paramedic friend of mine, and as far as them being overworked, and they said center paramedics work under medical directors and have authority to give several medications. They have the ability in their training and scope to give vaccines safely. And this is a key line. We need all hands on deck. And that's really the motto of the fire and EMS service. So I think they would look at this as a positive by far and not a negative. Thank you.
Yeah, before I call on Senator Washington, I think we need to be careful to place this as binary, that it's black and white here. I really, all hands on deck, they can do the COVID. And it's my understanding if there's a new disease next year and the governor sets an emergency proclamation and says they can do shots for COVID-18, that can be done. So, again, you can agree that, and again, NIMS and EMS are going to want greater authority. Anybody would like to do more than they can do now. I get that. But let's not do one is doom and gloom and one is this and that. I think we just have to be careful. There's gray here. And I would also say this, whatever amendment is selected, I believe the body is going to pass a bill. So we're going to have a bill. So, that's the sense of the body. That's not in support of one amendment or another, but I just think we should, it's not a binary situation. That's all. Senator Washington.
And thank you very much for that. I feel that way exactly about this, that all hands on deck is about COVID-19. It's about our this issue right here. And so to expand that rhetoric to allow a broader authority is potentially, unintentionally, an overreach that can be addressed if we want to look at having EMS become more integrated into the healthcare providing system in a non-emergency situation. Then that's a discussion that can be had. But specifically making sure that we do in fact have all hands on deck in the delivery of the vaccine for our current pandemic, this bill with the amendment would achieve that, in addition to allow them further authority to do what they're already doing in a limited population and allow them to do it to the broader. So I would really, really read the bill. It really does give a broader authority, even with the Lamb amendment. So I just wanted to make that clear.
I think we're fairly clear on it. I just want to put us where I think we are. Senator Simon Ayer would adopt the MIMS amendment and put a sunset of what? 3 years. Of 3 years, which would include a potentially broader authority if CDC approves other things. The Lamb amendment, and I'm going to assume extended a year. The Lamb amendment, which allows them to do COVID and any emergency and existing things, but doesn't allow future CDC decisions. And that would exist till 2023, what month?
I think we just changed the year, so April 30th, 2023.
April 2023. Please.
April is not a good termination month because it would require, if they do want to extend it, it would require emergency legislation. So I'd go with July 1st.
Okay, July 1st, 2023. So look, whichever one gets 6 votes is what we go with. Look, I want to, well, look, again, I think this bill in whatever form is going to extend their ability to do COVID beyond an emergency procedure, which was the primary argument they were making. So let's be clear on that. And people can disagree with the narrowing or the broadening, but we're going to pass a bill out of this committee. Senator Cortez, if you would defer, we haven't heard from Senator Riley on this issue.
Thank you, Mr. Chairman. I was getting ready to make a motion so we could have something on the floor to vote with.
Okay.
And but before I do that, I just want to make a comment. We trust our pharmacies to give a lot of these injections. These are intermuscular, they're not intravenous. It's vaccines which are not live things that you put in your body. I feel very comfortable with it. I'd like to make a motion that we accept the original bill, MEMS amendment, 3-year sunset.
Okay.
That's my motion.
Okay, then we'll deal with that one first. That's the one on the floor. So discussion is speaking to that in favor or against that motion. Senator Carrozza.
Thank you, Mr. Chair. I just wanted to clarify one point again for my colleagues in the interest of sharing information. The local health departments are asking for help for all the vaccines. So, I mean, again, so I know that we were driven on COVID-19, but I just want that this is coming from our local health departments. So I just think that's important, which is why MACO is, was supporting the bill as is, and also why you have the Hospital Association supporting this as well. So I just think that's important that we know that this is coming from the local health departments.
The amendment, the only thing I would say, and again, I'm going to support the bill, whatever the amendment is accepted. The next to last point Senator Lamb made, that CDC decides on a vaccine, not who should give it. They're two separate questions, but the bill authorizes people to give whatever vaccine CDC authorizes, which could be 2 years or 3 years from now, which might be more complicated. Just like we have the Pfizer under cold temperatures. And if we pass this bill and allow them to do the COVID until the COVID is over, there still could be a bill next year to expand the authority of EMS and MIMS to do other things. So it doesn't preclude a conversation about broader authority. Okay, if not further discussion on the Simon Air amendment, we'll take the roll call. It is adopting the MIMS amendment and putting a 3-year sunset on the original bill.
For July 1, 2024.
I'm sorry?
3-year amendment would be July.
That's what it does. Yep. Okay, roll call on the Simon Air amendment.
Wait, don't I vote first?
Yes.
You go first?
I vote first. Okay. Same as always.
Senator Kagan?
Yes.
Senator Lamb?
No.
Senator Farhester? Yes. Senator Ellis?
No.
Senator Gallion?
Yes.
Senator Bailey?
Yes.
Oh, I'm
Bailey
sorry.
isn't here.
Oh, I'm so sorry. I got the wrong one.
We'll take that.
Senator Carrozza?
Yes.
Senator Washington?
No, just explain my vote.
Put on.
Oh, sorry. No, just to, I support the expansion, but I'm very concerned about it going beyond. So I'm voting no on this version of the bill.
Yes.
in and see if the committee members who signed off on being co-sponsors for SB 67 were still interested. Yesterday, I had Senator Riley's name listed, Senator Carrozza, Senator Gallion, Senator Fry Hester. Did I miss anyone? The one that we just voted on. EMS paramedics.
If anybody wanted to jump on this bill that we just passed and amended. Okay.
Just an update, my daughter's 3 centimeters dilated, and you're more innocent.
Okay.
Okay, whoa. Senator Vice Chairman.
I'm going to get choked up now, of all times. But I just want to say this committee was beautifully represented on the floor in the tribute to President Emeritus Mike Miller. And I just want to thank and congratulate Senator Hester, Senator Simonaire, and Chairman Pinsky, because I think you each shared beautiful stories and personal remembrances and honored our late colleague. So I just want to congratulate and thank you all.
And we probably all have a bunch of other stories we couldn't tell them before. Everybody have a great weekend. Thank you for your help, cooperation, and engagement. Thank you.